Hey guys, it's Christina. It's the same hospital stay, but because I'm in here and we typically see patients in the hospital for occupational therapy, I wanted to talk about positioning in the bed because I'm actually having to stay in the bed a little more often. I definitely get up to my recliner during the day because you want to try to sit upright as much as possible to prevent your body from wearing out. And so I get up and do that on my own because I'm not a fall risk. I know that I don't have any balance problems. And other than having pneumonia, I'm a pretty healthy 35-year-old. And I train and work out, so I don't have any balance issues. If you have balance issues, it's very important that you always, always, always call do not fall. So you make sure you're using your call light and asking your nurse to come and help you get up. But positioning, let's see if somebody has a stroke, right? So, and they're flaccid on one side. Let's say they cannot move this. I'm going to move mine, but you need a caregiver or your other arm over here to help you position this arm. And ideally, that's what you want to get your loved one doing is self-positioning so that you can decrease your caregiver burden and increase their independence and attention to this side if they're not paying attention to it because of the way their stroke affected their brain. So basically, when they're in the bed, you want to, and they have like no active movement in their arm, you want to try to start working on shoulder shrugs, right? And seeing if they can just shrug their shoulder. If they get returned there, then you want to start seeing if they can move their arm forward or back and out to the side on the pillow. If they can get that return, you want to start seeing if you can help them move their elbow, and as soon as they can, you fade your support and let them start doing as much as they can on their own. You need to be working on turning over the forearm and popping the wrist. So that becomes extremely important for it to be elevated on a pillow. So I like to support the elbow underneath the pillow because the elbow is where a lot of the weight is from the shoulder. What we don't want to do is just let it hang down or get stuck up underneath them like this. So right here, there's a lot of pressure on my shoulder. But whenever I put it on this pillow, supported from the elbow to the hand, then my shoulder is in midline. It's not dropping in the socket, which can cause this bone to slide out of socket, causing a subluxation. And the other benefit is that it keeps the hand elevated above the elbow. So while this isn't actively contracting and being used, that excess fluid isn't just pooling out here in this extremity, causing a very swollen hand. And so you want to make sure with a stroke or with a shoulder injury, surgery, whatever, that you always elevate that arm, whether you're in the bed or you're in the chair. Any questions? Leave them in the post below. Please like and subscribe.